Hi everyone, it's Dr. Alfonso coming to you again from the Bengtson Center for Aesthetics and Plastic Surgery. Hope everyone is doing well and staying healthy. Today I wanted to take the opportunity to talk to you a little bit about one of the most common surgeries that we perform here at the office, a surgery that you may have heard of, commonly called a mommy makeover. The term basically means that patients who have had pregnancies that are unhappy with certain aspects of what pregnancy can do to women's bodies afterwards come in seeking rejuvenation, typically of the stomach, abdominal area, as well as the waist and often the breasts. So it's kind of been termed the mommy makeover because of the aspects of pregnancy, and for those women who choose to breastfeed, it helps to alleviate some concerns they have in that area. A lot of questions that patients have for us really revolve around the questioning whether or not these surgeries can be done together. And so the answer to that is typically yes. We always take into account patients' past medical history, but with the quality and improvements in our medications before surgery as well as after, it has made the recovery from a mommy makeover into a much easier process than it was a few years ago. So basically, describing what it is, it typically involves a procedure called an abdominoplasty or a tummy tuck, which we've talked about a few weeks ago, in combination with some liposuction either of the upper abdominal area or the waist, and surgery to enhance the shape and volume of the breasts. And it can involve doing a breast lift, which is simply taking a woman's tissue, lifting it into a better position, and making the breast perkier and less heavy. Or it could involve putting an implant in to add volume if a woman has lost a lot of volume over the course of multiple pregnancies and breastfeeding. So it's not a cookie cutter surgery. It's tailored exactly to patients' goals and desires and their anatomy. The surgery is done here in our licensed facility, along with our surgical team, including our board certified anesthesia providers that help to ensure your safety and comfort during the surgery. Some of the advances that I touched upon in the past come into play in terms of enhancing your recovery, and that is utilizing a long-acting local anesthetic that our anesthesia providers are able to inject into your muscles while you're asleep to help really dull any of the discomfort from the tightening of the muscle layer, which is typically done to improve the shape of the lower abdominal and upper abdominal area. In addition, we start our patients on medications before surgery so that your pain sensation and the nerve fibers are a little bit less active and allow for a quicker recovery, and really minimizing any narcotic use after surgery. We encourage patients to get up and walk right away, as it feels physically as well as mentally like you're recovering faster as when you're getting up and moving. The surgeries vary in length of time, but can go from anywhere from about 3.5 hours up to 5.5 hours. And that's really determined based upon what work needs to be done in the operating room in terms of the areas. Our surgical team is excellent at educating patients ahead of time about what to expect the day of the surgery, as well as before surgery, and then afterwards in terms of the recovery. Typically, I see patients back in the office about a week to 10 days after the procedure to check on everything and make sure everything's feeling well, and they also receive a call from one of our nursing staff the evening of surgery as well. Recovery-wise, it depends on what patients do for their type of occupation in terms of how fast can I get back to my job, or how fast can I get back to my exercise routine. Because the mommy makeover is a relatively involved surgery, operating on both the breasts as well as the abdominal area and body, the recovery can be typically a little bit longer than some of the other smaller procedures we do. That being said, for most patients who have an office type of job that doesn't require any heavy lifting or vigorous physical activity, they can plan to get back to work in about 7 to 10 days. If you include a weekend or two in that, it can extend it as well. And oftentimes patients will feel better than they expect as early as 6 to 7 days. But we always want to be cautious and give them a more reasonable, conservative time frame of taking off of work. So that's a reasonable time expectation for patients who are thinking about having the surgery done and how does it work in terms of the recovery. Until patients are allowed to do light exercise is about 2.5 to 3 weeks, and at that point patients can do some light arm weights, a little bit more vigorous walking, all while maintaining the compression garments that we provide for them in the form of an abdominal binder as well as a compression bra for the breast surgery. Patients tend to find this surgery as one of the most satisfying and gratifying for them because it's really a pretty miraculous transformation because of combining the breast rejuvenation with the body shaping. It really does a great job of transforming the areas that are of biggest concern. I hope that you found that this information informative regarding the Mommy Makeover procedure. We are encouraging patients, if you have any questions or concerns, again, to call our office and schedule a virtual consultation. In that, we set up everything online so that we can have a very private and secure conversation, and I can discuss with you, as well as with Dr. Bengtson, a plan for your surgery after reviewing your photos and going over the procedure. At that point, you will receive a quote in terms of the cost of the surgery, and 90% of the normal consultation can be done online. And the benefit for that is, while our office is not seeing patients, it allows us to get the ball rolling and get the procedure scheduled. In addition, if you have more generalized questions, I recommend sending them to our email address, askothesurgeon@bcaps.com. And we will respond to you regarding any questions you have regarding this procedure or other procedures I may have mentioned over the past few weeks. We look forward to hopefully seeing everybody in person again soon, and stay safe and stay healthy.